do you need to get a pelvic exam done? My name is Caitlin. I'm a certified nurse midwife, and I'm here to help you understand women's health topics that are commonly misunderstood. While it is recommended that women come in once a year for their annual, their well woman exam, you don't actually need a pelvic exam every single time you come in. What's a pelvic exam? Usually it involves examining the outside structures of the vulva, assessing the lymph nodes that are in that area, making sure that they're not swollen or enlarged, assessing to make sure there's no abscesses or breaks to the skin or other sores. A speculum exam, where the medical device known as a speculum is inserted into the vagina so that we can visualize the cervix, visualize the walls, make sure we're not seeing any other discoloration, abnormalities, sores, or anything like that on the cervix or the walls, as well as abnormal discharge, abnormal odors, redness, or irritation. This type of exam usually involves using our fingers inserted into the vagina with pressure on the abdomen so that we can feel and palpate the size and shape of your uterus as well as your ovaries. Now, when should you opt for a pelvic exam or come in specifically to have a pelvic exam? Well, if you're having pretty much any sort of problem down there, pain, itchiness, sores, sometimes pain with bowel movements or with intercourse, or fullness down there can indicate a problem. Another time that it's recommended that you opt for a pelvic exam is if you are overdue for a PAP. Generally, women from the ages of 21 to 30 should be getting a PAP done every 3 years. And women over the age of 30 can opt to get a PAP as well as an HPV co-test. HPV is the virus that causes most types of cervical cancer, done at the same time, and then you can wait 5 years in between testing. And that's just because HPV is so commonly the culprit for why we get cervical cancer. When we test for the abnormal cells, as well as the virus that's causing the abnormalities, gives us an extra layer of reassurance when it's negative. And finally, even if you're not overdue for a PAP, even if you're not having a problem down there, it's fair to want a pelvic exam just to check things out and make sure there's nothing that you're missing. But you don't have to. Just because you're coming in for your annual exam doesn't mean you have to have a pelvic exam.